Peyronie's disease causes the penis to bend at crazy angles with erections. It is associated with pain and even erectile dysfunction. Watch this video until the end to find out about the 5 facts you should know about this condition. They could save your sex life. Hi, my name is Stefan Buntrock. I'm a urologist by training and I am practicing in the lovely university town of Göttingen in Lower Saxony in Germany. Why am I doing this video about Peyronie's disease? Well, I see a lot of patients with this problem because I've subspecialized in sexual medicine. If you like my video, please give it a thumbs up and consider subscribing so that you don't miss out whenever I post new content. Peyronie's disease is named after French 17th century surgeon François de la Peyronie, who first described this condition. Basically, it's an inflammatory disease of the tissues surrounding the penile corpora. The reason for this response of the body remains mostly unknown. There seems to be an association with cardiovascular risk factors such as high blood pressure, diabetes, high cholesterol, but also with low testosterone levels, penile trauma during sexual activity, and an association with another of those French diseases, the Penile Contracture that is. This disease causes one or more fingers to bend towards the palm. They remain in this position and cannot be straightened out anymore. With Peyronie's, there is also bending going on, and this time it's in the penis. The penile corpora are surrounded by a whitish layer of tissue that fits them almost like a glove. This layer is called the tunica albuginea, and here is where the trouble starts. For normal penile function, the tunica has to be flexible to stretch out during erections. Peyronie's disease causes a local inflammation in the tunica which reacts with thickening and local contracture. These areas can even be felt as hard nodules or areas within the penis. As a result, the particular spot will act like a hammock and the penis will start to bend around this location. A so-called hourglass configuration of the penile shaft will be visible in many cases. Penile contracture can reach crazy angles up to 90 degrees, sometimes even more, so that sexual intercourse is no longer possible. So here are 5 important facts for you to know about this condition. Fact number 1. It is not a rare disease. Certain areas of the bodies are taboo when it comes to diseases. This is particularly true for penile conditions, so nobody talks about them. But that doesn't mean that they're not existing. Peyronie's disease occurs a whole lot more often than most would think. It is estimated that up to 1 out of 10 men will be diagnosed with it at some point in his life. Fact number 2. Peyronie's disease is not exclusive to the elderly. In fact, it can also be seen at young age, depending on the presumed mechanism of origin. If there is trauma involved, it might as well develop in somebody's 20s. 10% of the patients with Peyronie's disease are younger than 40 years. Fact number 3. Look out for painful erections. Especially in the beginning, painful erections happen in the majority of men. They are a sign of the inflammatory process. This active phase lasts for as long as 1.5 to 2 years, and here is where all the bad stuff is going to happen. We'll come to treatment in another video, but early detection increases the chances of a favorable course of the disease before it is too late and only surgery can help. It is the first and foremost goal to stop the inflammation at this point so that penile deformity is prevented. Many men ignore these first subtle signs and present in my practice at a late stage. In late stage, all the damage is done and the detrimental activity comes to rest. Calcification takes place and the hard areas in the penis become visible upon ultrasound. Fact number 4. Peyronie's will cause the penis to shrink. Most men with Peyronie's disease will lose penile length. The amount of the loss is highly variable, but most will notice a 1 to 2 centimeter shortening equaling a 1/2 to 3/4 of an inch. Fact number 5. Erectile dysfunction is likely to happen in men with Peyronie's. More than half of the men with PD suffer from erectile dysfunction. The problem originates in the blood outflow. Blood cannot be kept within the cavernous bodies of the penis. As a result, erections cannot be maintained or even reached. This is it for now. Thanks for watching, and if you like this video, you might be interested in the treatment options which I will publish in another video. Bye for now.